sanitation and environmental sanitation and clean water supply is a challenge. So in a nutshell, that is the much that the public also needs to know at this moment about cholera. Thank you.
It's all right. Dr. Obam, I am back to you now. And this, from the definition the director highlighted, he pointed out that it is a food and waterborne disease. Being a food and waterborne disease that cholera is, how can it be spread?
Okay, thank you for a wonderful question. Okay, just like the earlier speakers just said, it is a water and foodborne disease. It's a bacterial infection, just like the director has highlighted earlier, and majorly it is transmitted via consumption of contaminated uh, food or drinking of contaminated water. Its spread is actually from human to human. This is because most times if an individual has this infection and they are defecating in a situation whereby in an environment where they defecate indiscriminately, there is no hygiene attached to the way they use the toilet. Maybe after using the toilet you don't wash your hands, then those people that also get to eat food along the way too, because you don't know where the water that is being used to prepare these meals are gotten from. So in a situation where these meals are contaminated, an individual is expected to have it when consumed or when this water is drunk. So basically, that is the way this infection is being transmitted. It's a human to human transmission, basically. Thank you.
Okay. Dr. Igbabuul, let me come back to you. Being an infection that is transmitted or human to human, it doesn't mean coming in contact with a specific certain things that will make one come down with cholera, or it's just what it's basically its mode of transmission, being it human to human.
Like my colleague has just said, it's what we call in our medical parlance a fecal-oral, that is from feces, from the mouth, from the feces to the mouth, like that. So once the stool of a sufferer, a patient of cholera, once it contaminates water and food sources, and then another person it gets in contact with these food sources or water from use of hands and then eating or drinking, then that person comes down with the disease. Although not those who come down with the disease, many of them may not show symptoms, but they will continue to spread the illness from their feces. So hand washing is very important. There has to be contact with the contaminated source, and then the mode of entry again is through the mouth. So this is the way it's transmitted.
Okay, Dr. Ijabo, let me come to you now, and this time we'll be expanding on the symptoms of cholera. What are its symptoms?
Okay, we by symptoms, which is also what we usually use also in our effort to detect and diagnose cholera, within the population. So some of the common things that we see related to cholera for patients is profuse, large volume diarrhea. Now, it's diarrhea disease is common, especially in children below 5, and also in the rest of the population. Could be due to different causes, but that for cholera is specific. It's pathognomonic because there you see what we call large volume. The diarrhea episodes come with so much fluids, and after a few bouts, you have weakness, tiredness, in these patients. So when we encourage the populace that when you experience such, or if someone around you, has this, begin to think of cholera and run to the hospital immediately. Some of the other signs I could see as a result of this large volume episodes of diarrhea is, like I had mentioned, weakness, which is as a result of dehydration, because such a person could, with losing so much a volume of fluid within a very short time, could go into dehydration, and that's where death would come from. Now, there may or may not be fever, in diarrhea cases, but the age bracket we look at, for cholera also is from 2 years and above. So in a nutshell, anybody who's experiencing large volume diarrhea, we also call it rice water, because the stool looks like this the water after boiled rice is washed. It looks somewhat like that. So it's a kind of a nickname called that is attached to it. So we have large volume rice water looking stools in persons above the age of 2, which could lead to tiredness. So they'll need to get to the hospital as fast as possible.
It's
to
okay.
Avoid complications.
All right, Dr. Obam, let me come back to you now. From the age of 2 and above, which Dr. Igbabuul pointed out, doesn't mean once age 2 and above, anybody is prone to coming down with cholera, or are there specific categories of people within an age bracket that are prone to the risk of coming down with cholera?
Okay, thank you. At that age group, they are actually prone to having cholera. But then, for an individual to come down with these symptoms, there are certain things that are determined. First of all, is of course the age of the patient. Then the immunity status of this patient is also required. Then, of course, the volume is stated that the amount of the bacteria that is being infected in this individual. So, for instance, someone who is malnourished, somebody who is malnourished, you don't expect the immunity of such person to be optimal. So, such an individual will definitely come with symptoms, or even more severe symptoms compared to someone who is not malnourished. Also, there are other patients too who might have other comorbidities. Just like I mentioned, malnutrition, those of persons that are even diabetic too. Other comorbidities like those who are HIV positive too. Those ones, they are in a situation where the immunity generally is suppressed. Those persons are more likely to come with these severe symptoms. But by and large, any individual who has this infection might likely be present with any of these symptoms. Even the adults too, who come in contact with these bacteriums, will also have that likelihood of coming down with these symptoms. But like I said earlier, the immunity actually determines whether these symptoms are severe or not.
All right, Dr. Igbabuul, I am with you now. You are aware that there is an outbreak of cholera in the country. It is reported in over 30 states across the country, with deaths also confirmed. What is the situation in Benue? Have we had any case or suspected case?
Yes, thank you for that question. I'm aware, and NCDC, that is charged with handling outbreaks in Nigeria, and has already reported that there are over 1,000 cases nationwide. 90% of them are in 10 states and 96 local government areas. But I think the highest hit is Lagos, that has over 300 suspected cases and some deaths, about 15 of deaths. But for Benue, of all these 96 local government that has surveillance has picked up cholera, we have not been able to, in Benue State, we have not recorded any case of of cholera. This year we had 6 suspected cases, which was picked up by our surveillance system, SOMAS, but it was not a confirmed, and none of them was confirmed to have cholera. So for now, I can say that we haven't had any case of cholera in Benue.
Okay,
for this year.
And there is, even as we speak at the moment of its outbreak that is ravaging the country.
Yeah,
it
the
has not been.
surveillance system is yet to pick up any case.
Okay, let me come to you, Dr. Igbabuul. You are the Assistant State Epidemiologist. What is the level of surveillance, disease surveillance, especially focusing on cholera now that it is ravaging parts of the country?
Okay, before I go into that, I'll just also give a rider on my colleague's contribution earlier, in responding to the persons who could be at risk for cholera. We, in addition to those with issues of immunity and all of that, we also look at those who reside in particular types of settlements and particular types of social strata. Now, I'm talking about that if we have persons who live in very crowded areas, slums, and these are places that usually lack the basic amenities that we need, part of which is potable water that my director mentioned earlier. Now, these populations are more at risk of coming down with cholera. Now, I mentioned this also because it also informs the nature of surveillance that we mount for diseases like this. The surveillance structure for cholera is like any other surveillance structure for all the 46 priority diseases that are being surveilled for in the country, Benue inclusive. We have robust structures at the local government areas. That's from the community level through the community informants. They have been trained on the case definitions and what to expect, what to look out for as far as cholera is concerned. Now, we have these community informants in most of the communities in Benue State. These community informants feed into ward surveillance focal persons. Now, these ward surveillance focal persons, in turn, they supervise what the community informants do and also feed information to the local government disease surveillance and notification officer. And now, at that level, that comes up, the DSNOs also report to the state epidemiologist, who in turn reports to the director of public health. So this is the surveillance structure that we have. And then these structures also cover all the 277 primary health care centers in the 277 focal sites. Because we have one focal site per ward. And so we have, for Benue, we have 277 focal sites, 277 wards. So we have 277 focal sites with surveillance officers mounting this, all to ensure that once we have any suspected case at the level of the community, using this chain, information goes up to the level of a directorate and of course the Commissioner for Health as fast as possible, and then feedback also goes down that chain also to ensure that response to whatever has been picked is swift and within good time. So this is the same structure that that has picked the 6 suspected cases that my director earlier mentioned, and it is still in place, and every day cases are being looked for, in addition with other priority diseases that we also mount surveillance for. So that's what's going on at the moment.
Okay.
I would like to add.
Okay.
Now, at this point, I think it is good for everybody, all the listeners out there, to know what a suspected case is and to be able to identify the suspected case. And that will add up to our surveillance system and make it more robust. So I want to bring to the attention of everybody there, if anybody, any child who is older than 2 years, or any adult that now is having acute profuse watery diarrhea that even leads up to dehydration, that person is suspected to have cholera, particularly at this point in time when the rains have just started and is ongoing, when there's the likelihood of flooding, and when especially as is mentioned in slum areas or in places like IDPs that may lack potable water supply or even sanitation system. So let me come again. Anybody, child older than 2 years that has a acute onset of watery stooling and is so severe as to cause dehydration, that person should be suspected of having cholera and should be reported to all these community surveillance outlets that Dr. Igbabuul has mentioned. So together we'll be able to pick up cases very early, and you report it to the health authorities, in fact the health clinics near you, and you'll be sure to have help. And that way we'll be able to reduce deaths.
Okay. Dear listener, in case you are just tuning in, you've been listening to Perspectives on Agate Radio 95.5 Star FM Makurdi. We are discussing sensitization for the prevention of cholera outbreak in Benue State. And our discussants here in the studio, I have with me the Director of Public Health in the Benue State Ministry of Health and Human Services, Dr. Shember Igbabuul. I also have the State Assistant Epidemiologist in the State Ministry of Health and Human Services, Dr. Henry Ijabo, and a resident doctor in the Department of Family Medicine at the Federal Medical Center, Makurdi, Dr. Emmanuel Obam. They are leading us on the discussion, and you too can be a part of the program by sending us a message or calling later at 10 o'clock to make your contribution or ask questions on the subject we are discussing. Already the line for text messages is activated, and you can send a message to it. The line is 0912-699-9404. 0912-699-9404. That line is already activated and available for messages and chats on WhatsApp. If you are sending a message or a chat, kindly include your name and the location you are sending it from. And later at 10 o'clock, this line, which I'm calling now, will be available for you to call in and ask questions or make contributions on the issue we are discussing. The line is 0814-335-9292. 0814-335-9292. You can also follow us on all our social media platforms on Agate Radio and TV, where this program is streaming live on Facebook, YouTube, Instagram, as well as X, formerly Twitter. You may also log on to our website on www.agateradiotv.com to listen to us live. If you log on to the website, kindly check the top right corner, click on the radio icon there, and you receive us live from that platform. And also, if you have your Radio Garden app on any device at all, you can also listen to Agate Radio there. Dr. Obam, I am with you now, and this time around, I would like you to speak to us on the risk factors of cholera. What are those things that will make a community or individuals more prone to it, the risk factors?
Okay, thank you for that question. Like we have stated earlier, there are risk factors to having cholera, and my colleagues had already enumerated some of them. But then, particularly the area in which people live matters a lot. And if those are staying in slum, unkept area, people who don't keep their environment clean are at higher risk of having cholera. Also, individuals too who eat on, as in, that is not properly prepared meals, or drinking water that are not properly prepared. Those persons too are also at higher risk of having cholera. Of course, like we stated, it still depends on the immunity of these individuals. Those who have chronic illnesses like diabetes mellitus, those who have tuberculosis, infective diseases like HIV/AIDS, those people who are malnourished too, and especially at that age group, 2 years, the immunity is not as strong as the adults, so they are prone. They have the higher risk of also having this infection. So there are people too who don't prepare their water very well. They just fish from the stream, fish from anywhere they feel they could fish from, and just drink without preparing this water. You are also at a very high risk of having this infection. Then, like I said earlier, those who eat those food without knowing how these foods were prepared, they also stand a chance of having this infection. Basically, these are the risk factors for individuals to have this cholera infection.
Okay, Dr. Ijabo.
Let me add to what he has said.
Oh, okay, all right.
Yeah, I think our listeners there should be wary, particularly this time, that the rains have come and there's a likelihood of surface contamination of flooded water. And the fact that some people still undergo, well, they take, because of a poor system of sanitary, they still do open defecation. Now, if you live in such places where people are still practicing open defecation, you have to be more careful with your source of water. You need to treat the water by boiling first. Again, those who have the habit of they collect food and then without washing their hands and then they throw in, like our people, there's what they call punguma, you know, these snacks, these local snacks that you just pick on the road, and the next thing is you wash it down. Or those who eat guru, for instance, after so many people's handshake, and then you just take you think it's an ordinary snack. You don't need to wash your hand, and then you start ingesting it. Now those are the people that they have to check. They are at risk, especially at this time. They need to check their personal attitude to hand washing before ingestion of food. It doesn't have to be the food staple that usually you have before you wash your hand before it, but at any point in time, we'll emphasize more and more hand washing. And those who don't have such habits, they are also more vulnerable and more at risk.
Okay, so Dr. Ijabo, I wanted to come back to you on this same issue of surveillance. Earlier on, you stated out the structure that has been outlined for disease surveillance. Is this a structure already in place, or currently as the cholera is ravaging the country, has it been activated? And what are the responses you are getting, especially at the community level with regards to your surveillance?
Okay, the surveillance structure I mentioned earlier is surveillance structure that has been in place and active for years. This is the same, I think earlier in the year we were here, I think my director and I were on a number of radio programs also to speak on the Lassa fever outbreak we had earlier, which is winding down thanks to the surveillance efforts and the response of government to the outbreak. This same surveillance structure we're talking about is what also picked all the cases that we had because of the Lassa fever outbreak, and it's the same surveillance structure that's still at play. Like I said, we are always tracking events of public health importance within the state, and diseases are also part of that, especially priority diseases, which cholera is one of them. So the surveillance structure is very active, um, and that this is the same structure that was able to pick up the 6 suspected cases my director mentioned earlier, and the officers involved, like I mentioned, they are trained, they're on their toes and working actively. And so, if for any reason there's any case within the community at any time, we are very optimistic that the officers on ground, the boots, on the ground, will pick up any change, and detect the case from time to time. Now, this surveillance, mounting this surveillance, for diseases is routinely is also very important, because now we have, people travel. You can have somebody in Nasarawa or Abuja in the next 2 hours is in Benue, so we don't know, we don't know what the person is coming in with. And so with the trans-state border, international border travels,
Yes.
it's very important that this action, is sustained, and that is what we're doing in the Ministry of Health, down the line across all the different structures. In fact, in the course of the week, we had engagements with traditional healers and traditional bone setters within the community also. That is how far the surveillance efforts have gone, because we know, because of the mixed level of knowledge and information we have out there in the community. Some persons tend to believe that certain issues are not hospital problems. When they have issues, they move straight to the traditional structures of treatment. Now, while we are not antagonizing anybody, but at this point it's important that we put the right information out there. And we've also partnered with these persons I've mentioned, traditional healers also, so that when they see cases, sensitizing them on the case definition for some of these priority diseases, including cholera. So once they see cases like this, they should not hesitate, to refer these cases to the hospital. So this is how far and how robust the surveillance structure is. It's very active, and as we speak, it's still working.
All right.
So let me add.
Okay.
The surveillance, the whole idea about surveillance is to make sure that we are prepared. So we put in a formidable health structure, which will be able to investigate and also put up control measures. We are aware of this at the ministry under the able leadership of Dr. Yama Otese, and with the backing, the commitment, the political commitment of His Excellency Reverend Father Dr. Yomim, Hysen Yomim, Ayi Alia. And for that reason, the structure itself is ready, because we are aware, like he said, the cases are close by. It's here in Nasarawa, and it can be imported directly to us. And so we are aware at the ministry. That is why we're strengthening the surveillance system to make sure that we mitigate it if it comes in any time. So we also, the Public Health Emergency Operations Center, that is in place, and it's like a command center that brings together all the experts from different fields. And once it is activated, if we have the case in outbreak proportions, we immediately activate the Public Health Emergency Operations Center. And all the line ministries that are involved are also engaged, and with a bid to curtail the outbreak that is happening to us. So even for, just like in any other outbreak, for these two, we are prepared. The structure is in place, and I want to assure you and the public that at the Ministry of Health, we are prepared.
Okay, you actually preempted what I was going to move into, because In fact, you mentioned Nasarawa very close, and already there are confirmed cases in Nasarawa. Nasarawa, that is, in terms of proximity, its nearness to Benue is there. You know, people travel to Lagos. There are deaths recorded, and other parts of the country too. So, in terms of contact tracing, in the event that it occurs, what kind of contact tracing will be done for us to detect where exactly such cases may have been reported or detected?
Yeah, I want to quickly add that, like I mentioned, all the line ministries, the Ministry of Information and the Ministry of Water Resources, even the media, you are involved in all this. It's a collective effort.
And that's
will
why
make sure that we
for
do
us,
that.
I Get Radio, we're
And
taking
that's
the
why
lead.
we're happy to have been invited and also to be part of this. And so we also encourage the other media outlets to join in so that our people are well sensitized. And once the sensitization is there, people can actually recognize the suspected cases and report. And once they report to us, we immediately we have soldiers on ground that we deploy in order to do an outbreak investigation. They go through the 12 steps of outbreak investigation, and the control measures are instituted immediately.
All right, Dr. Obam, speak to us about the mortality ratio of cholera, maybe in previous outbreaks. What is its mortality rate?
Okay. The mortality rate of cholera is actually high. In fact, as at 2022, according to WHO information, the mortality at that time was about the general infection in that year was 473,000. Above that, then the mortality at that time was almost 150,000. So that's almost 50% to 70% mortality. So it's actually that high, especially if these symptoms are not mitigated as fast as possible. Individuals who come down with profuse diarrhea, maybe associated vomiting, and are already dehydrated, they are supposed to be attended to immediately. If not, the mortality rate is as high as about 90%, as high as that. But once treatment is instituted, the mortality rate drops to even less than 1%. That is how dramatic this infection is. So it's actually very high. As at 2023, the infection, according to WHO, doubled, almost doubled. That is 700,000 infection globally. Then 2021, it was around about 300 or thereabout. So these are figures. And once the infection increases, the mortality is always high, except these individuals are treated as fast as possible. So it's high.
Okay, Dr. Ijabo, from your records in the ministry, has there been a record high mortality in Benue in previous, because this is not the first time we're recording outbreak of cholera in the country, certainly. So speak to us, what has been the situation from your records in the ministry?
Okay, we've been tracking the efforts, the data on cholera, for over 4 years now. Okay, so this year now being the 5th year, of course. So since 2020, we've had in 2020 we had about 316 suspected cases. Out of this, we were able to confirm 3 via RDT. We lost 3 patients that year. 2021, the figure of suspected cases doubled to 718. We were able to confirm 12 via rapid diagnostic testing. We confirmed 1 via culture, which is actually the gold standard for diagnosis. But deaths from, no, but now this will be deaths from suspected cases. Now was 52. So there were lots of deaths in that year that happened before um, we were able to carry out tests, because we had sudden outbreaks in communities, where information was coming out almost at the same time as mortality was happening. But we were able to go in and arrest the situation. So far, if you compare 2022, we had 2 deaths from suspected cases, and by and large, the mortality rate for Benue has not been as high, as talking about collective mortality rates now, compared to the number of suspected and confirmed cases, that we've had. But when I also mentioned confirmed too, we also use it loosely, because there are two diagnostic modalities for cholera. We could use the rapid diagnostic kit, then we could use culture, but culture is the WHO standard for diagnosis of cholera. So, but since most of the time, the rapid diagnostic kits, which we circulate within the local governments. In fact, as we speak now, those kits have been distributed to all the disease surveillance and notification officers waiting at the local government areas, just in case there are suspected cases, to carry out testing as fast as possible. So compared to that, mortality rates have not been very, very high. But when you look at individual chances or prognosis, now it could be high depending on how fast the person, how fast the disease is detected and treated. So that again is where we are for Benue. Thankfully, our mortality rates are not as high compared to the national figures, for all the past years. Well, thankfully for this year, like we said, we've just had 6 suspected cases. We've not had any confirmed case yet, and of course, we've not had any mortality, both in suspected cases and of course, there's no confirmed case. So that is where we are, and we're really hoping to keep it that way.
Okay, Dr. Igbabuul, is there something you would like to add to this, and also
Yes, I want.
also expand more on diagnosis for cholera?
Okay, thank you very much. Although we've been, can I say, fortunate in Benue not to have recorded deaths, but cholera is a very serious public health emergency that people should take it very serious. It causes, like my colleague Dr. Obam has said, it causes mortality as high as 50, even up to 90%. Currently, in the country, they recorded, from what NCDC has reported, 65 confirmed cases, and 30 of them died. That makes almost 46%, and that is high. And the mortality can be influenced, like Dr. Igbabuul has said, based on the health-seeking behavior of the people. Now, we want to encourage our listeners out there that they should help us. They should shine their eyes and look out and for suspected cases and bring them to our attention so that we can make a definitive diagnosis. Like I said, we have these rapid diagnostic kits that have been positioned in all the surveillance points across the states. Once our disease surveillance officers are notified, the first thing they do is they make sure that they subject the stool to the rapid diagnostic test and then also report accordingly. We also take those samples and we immediately send for culture, and once it is confirmed, we go in, and then for outbreak investigation line list all the cases that are there, including those that are contacts, and we quickly pick up more suspected cases and then make sure that we bring them to diagnosis and institute early control measures. That will also help to reduce those that die, and also cut off the transmission and make everybody safer. So these are things that we do. We must not underplay the fact that we're dealing in cholera, for instance, we're dealing with very serious health emergency. Like Benue, I'm happy for this this discussion, and I hope that we'll put cholera in the air from now on, since our neighbors are already recording cases, so that more awareness will be created out there, and people should be ready to, suspect cases of cholera and report to the health authorities.
All right. In about a few minutes from now, we shall be opening the line for you to call in, dear listener. If you are just tuning in, the program is Perspectives on Agate Radio. Our focus is on sensitization for the prevention of cholera outbreak in Benue State. And I have here in the studio our discussants, the Director of Public Health in the State Ministry of Health and Human Services, Dr. Shember Igbabuul, is with us. We also have the Assistant State Epidemiologist in the Benue State Ministry of Health and Human Services, Dr. Henry Ejabo, and of course, a resident doctor in the Department of Family Medicine at the Federal Medical Center, Makurdi, Dr. Emmanuel Obam, is also with us on the program. And if you are calling in at 10 o'clock, the line to reach us is 0814 335 9292. 0814 335 9292. Once you call in at 10 o'clock and we pick your call, kindly introduce yourself. Let's know your full name and then where you are reaching us from. Then you go ahead and make your submission. We are bid that you keep it very brief, within 2 minutes, to enable others also have the opportunity to participate. Meanwhile, the line for text messages and WhatsApp chat is already activated for us to take your messages or questions through that line. The line is 0912 699 9404. 0912 699 9404. You may also log on to our website on www.agateradiotv.com. If you log on to that website, check the top right corner. There is a radio icon there. Click on it and you'll be sure to listen to us. And if you have your Radio Garden app on any device at all, you can also listen to us. On all our social media platforms, the program is streaming live there. Follow us there, like and share the pages. Share the links with as many of your friends as you can, so as to enable them to be a part of this crucial issue we are discussing. But before we open the line shortly, Dr. Obam, I'll request you to speak to us briefly on ways of management. How is cholera managed or treated?
Okay. Well, to manage cholera, there's this need for prompt treatment, prompt diagnosis and treatment. And how do you treat? First of all, an individual will have to present, you have to take a history taking. Individual present with profuse diarrhea. They might be associated vomiting. The individual becomes lethargic, comes in with weakness, and there are other symptoms too that an individual might present with. Once an individual comes like that, we always want to categorize this patient. And in terms of categorization, is either this person is dehydrated or not dehydrated. And if this person is dehydrated, is it mild dehydration? There is a classification that you could use: mild, moderate, or severe dehydration. There is other one that you could also use no dehydration, some dehydration, and severe dehydration. So it depends on how this individual comes. Just like the earlier said, the diagnosis majorly is clinical, especially in a resource poor environment where maybe we might not have access to the rapid diagnostic kit or even the culture that is required by WHO for as gold standard. So you need to have a high index of suspicion, an individual who comes in with profuse diarrhea. Then resuscitation is always key. And how do you resuscitate? After categorizing this person, for instance, if this patient is in mild dehydration or no dehydration, the mainstay of treatment is rehydration. How do we rehydrate? You rehydrate with ORS. If it is either mild dehydration or no dehydration, ORS is given to this individual. About 50 ml to 75 ml per kg is given to this individual within the first 4 hours for mild or no dehydration. But once an individual is going into moderate or severe dehydration, especially if it is severe dehydration, there is need for intravenous IV fluid. And intravenous IV fluid, the fluid we use majorly, the fluid of choice is actually Ringer's lactate. But in a situation where Ringer's lactate is not available, normal saline could also be instituted. Okay, how do you know that an individual is dehydrated? Of course, they come with a dry mucosa, that is dry mucous membrane, that is the lips. The lips look dry. Some will come with sunken eyes. You see their eyes, they are sunken. Then there's what they call skin turgor. When a skin is pinched and released, the manner in which it goes back becomes very slow. Then, of course, there are other signs that an individual, a clinician will also get, like tachycardia. They also might have come depending on the severity of the illness. So basically, the treatment is purely rehydration. Of course, there is an advocation for antibiotics treatment too as well, and the drugs of choice are either doxycycline, erythromycin, tetracycline, depending on the one that is available in the facility. This is at the physician's discretion. Any of those listed, the antibiotics could also be used. So basically, the gold standard of treating it is rehydration, because if you don't rehydrate this patient, the patient might either die or develop other complications. There are other complications too that they might also arise from severe dehydration. The individual might have acute renal failure, they might go into shock, and at that stage, it will be very, very difficult to manage, especially in a hospital or facility where the resources are not available. So basically, it's rehydration with ORS for mild and moderate dehydration. But once an individual is in severe dehydration, intravenous fluid with the use of Ringer's lactate or normal saline is advocated.
It's okay. It's up. I will come back to.
I just wonder.
I would have loved you to sincerely add, but it's about time now for us to engage with those listening to us. So let's engage with some. We'll come back to attend to address more issues. The line is still open: 0814-335-9292. 0814-335-9292. Remember, we are discussing sensitization on prevention of outbreak of cholera in Benue as part of Agate Radio's contribution to helping the situation. Hello. Good morning.
Good morning to you.
Welcome to Perspectives.
Yeah, my name is Peter Ode. I'm calling from Higher Level here.
Good to have you on the program, Peter Ode.
Yeah, I want to thank the doctor in the house and you, the host.
Thank you, Peter.
And what I want to say is this. The problem we are having in Nigeria here is the sustainability and implementation of programs. You know that even if something like outbreak of cholera is not happening, you never hear anything about it again. They will say it once in a while. But now that outbreak has come up, you will hear it in the radio. If you open it, everywhere now you hear about it. So my advice now to government is, when it can, especially there is a saying that health is wealth. Anything that concerning life, especially like that, like outbreak of cholera or anything at all concerning health, if there is implementation and sustainable, all these things will be avoided. Could you believe that according to the analysis the doctors are giving in the studio there, express it, how comes, how those things come about and what causes it. Do you believe that if you move about in Benue State here, even in town we are living here, there are some houses, if you go there, there are some landlords that don't even have the toilet. And government will just put a lip mouth on it. They will not even care to move about and say. And that is where we are dying from. That is where the problem coming from. And they will not do anything about it. Another one is that even if you're moving on the street now, you will see those food vendors, those mama food now. When you move about now, you see them lining up. Some, they will not even care to even raise the plate before they will eat. They put food for them. And you don't know where problem is coming from, and nobody is talking about it. It's when the problem come up, you come to the radio and begin to say it, and there is no implementation about it.
Okay.
So my advice now is that let the government, whatever the law that is put in place, let them sustain it and keep reminding us every now and then, because human beings need to be talking to every now and then.
All right.
If not, nobody is scared.
Thank you.
That is my submission, please.
Thank you very much, Peter Ode. We appreciate your submission, and that is why for us, I Get Radio, well, we are taking the lead to bring you this program to sensitize. It's part of our sustainability, and of course, there is no better time to talk about cholera now, especially now that its outbreak is ravaging parts of the country. The program is intended to forestall its outbreak in Benue and to guide you on what to do eventually if any suspected case is noticed in your community. Thank you all the same, Peter, for calling. We appreciate you. Hello, good morning.
Good morning.
Morning to you.
Good morning, Nathaniel.
Welcome to Perspectives.
I want to appreciate your guest. My name is Daniel Tena from Nongu here in Makurdi.
All right, good to have you on the program, Daniel.
Thank you so much. Hi, I want to appreciate I Get Radio for bringing this wonderful topic on this on this station, because this is what is bothering us. You see, your discussants have spoke very massively on this topic. That is why they are professionals. I want to salute them so much. You see, the truth of the matter is, if you are talking of cholera, you cannot talk without bringing hygiene. I know hygiene is fully involved on this. And we, the human being, how many of us are ready to do what they are telling us there? Because sometimes, to my greatest surprise, sometimes when you go to somebody's house, the level which, even there are some areas here, if you go to somebody's house, say, help me with a cup of water. That time I'm telling you, even if they give you the water in the cup, even to drink it, you won't be happy, because the cup itself will be dirty, and the water will not something to talk about. So I want to urge us that please, we need to keep our environment clean. We need to keep our environment clean so that we can protect this disease. And apart from that, sometimes, if like now we're in rainy season, if you go now, some gutters, people will leave that dustbin. They will come and point refuse in gutters. This is very, very bad. It's very bad. And talking about the water, we know that some areas in Makurdi here, like Nongu where I'm living, Prof can testify. The doctor is my neighbor. He can testify. If you go to Nongu, people do so much water, but there are some water there are some chemical that we can treat water, like water guard is there. But some people, when they go and fetch the water through the well or borehole, even some borehole are still salty. They are not good. So I want to advise us that please, if you buy water that you can know that the water is not good to drink. You can go and buy water guard and some chemicals so that we can treat. So end of the day we can prevent this thing. I'm so happy, and this is like I want to appeal to the government too. They should touch the IDP camps, because them, as they say, they are in IDP camps. I know that they may be facing this thing more than we.
Thank you.
Even some areas. I'm sorry to mention one area. Let me just mention. If you go to one Jukum and Wadata, there are so many places that sometimes you can see there will be dumping refuse at top of the main house. It's very bad. So let us help government, and they're helping us. Let us help ourselves.
Thank you, Daniel.
Have a nice day.
Have a nice day too. Thank you very much, Daniel, for calling in. We appreciate you for drawing the attention of the authorities to what is happening in some parts of the state's metropolis where they need to give attention to. Hello, good morning.
Good morning.
Welcome to Perspectives.
My name is Mr. Governor Augustine, calling from Agasha.
Okay, could you speak up? Let's hear you. What did you say your name is?
Mr. Governor Augustine, calling from Agasha.
Okay, Msega Augustine, welcome. Go ahead, please. Hello, Msega. Oh, so sorry. Msega just wanted us to hear his name on radio, and he would drop the line when he had the line to speak to us. He didn't go further. But all the same, the line is still open. You can call in 0814-335-9292. 0814-335-9292. Hello, good morning and welcome to Perspectives.
Good morning.
Welcome to the program.
Thank you. I'm Patience calling from Minor Quarters.
Okay, Patience who, please? Hello? Oh, okay, Patience. Why am I suspecting that there is a network glitch somewhere? But the line is open. Do call back if you can, Patience. Hello, good morning. Hello, good morning. Good morning. Welcome to the program.
Hi, good morning.
Welcome to the program.
Yes.
I'm Patience calling from Minor Quarters.
Okay, Patience who? Oh, okay. The line is still open for you to call in. The line is 0814-335-9292. 0814-335-9292. But before we engage with more people, Dr. Igbabuul, you had wanted to add something to the management and treatment of cholera, and there are other issues as we go along. So comment on that briefly before we engage with more.
Yes, thank you very much. I was saying the success of management
Yes.
has a lot to do with the individual. At home, when you start having the symptoms of watery stooling, that is when you have to start taking action. ORS is easily available everywhere, and WHO recommends that one sachet in 1 liter of water, and then you start taking it. First of all, it will replenish your energy, and it will enable you to go to the nearest health provider. And that will go a long way to give success to your treatment. So I encourage our people out there to make use of ORS as soon as they start having profuse stooling, even as they make their way to the health facility. There's a lot of success that we can also achieve in the control and prevention and control of cholera. Like the callers mentioned, we will not have to depend solely on government. Personal hygiene and the lack of it has to start with us and actually end with us. When you wash your hands more frequently, and you make sure you use clean water, potable water. If you're not sure of your water supply, the least you can do is boil it, and then it will render it germ-free. If you must eat at eateries, you make sure that even the bowl that they gave you for washing, let it not be one that is being reused by so many people. And it's easy for you to know. When you see, if it's an oily thing, you see the rim of oil around the edge of the bowl. You will simply see that somebody else has used it. Insist that those people give you a clean bowl and clean water in order to wash your hand. And by and large, cleaning your environment, making sure you dispose your refuse properly, making sure that the gutters around the flow.
I'll beg to interrupt you briefly. Hello, good morning.
Good morning.
Thank you so much for holding on. We'll come back. I'll come back to you shortly, sir. Welcome to the program.
This is Kwaza Vincent calling from North Bank, Makurdi.
All right, good to have you on the program, Kwaza Vincent.
Yes, I greet Target Radio and the guests in the house.
Warm greetings to you.
Yes. We thank God that Target Radio is bringing out this program at this particular time that the rainy season has just begun in full. You see, sometimes our attitude contributes to most of the diseases we see that come around us every day. You see, like when you go to most of our places now, these empty bottles of chemicals, herbicide, or pesticides people spray in their farms, they drop it anyhow. Lack of this, they don't dispose it well. they drop it anyhow, and when rain fall now, sometimes these containers will now wash to the only source of water that is available for people to drink. And when it's washed to that particular place, people drink, and now you discover that most of these diseases will now come out. So if law can be made that once you dispose this thing, you should be arrested and then be prosecuted, it will go a long way in helping us in containing some of these airborne or water diseases that we notice around us. Thank you.
Thank you, Kwaza. Thank you. I appreciate you all the same. There are sanitation laws, so I don't think there is any law that will need to be made fresh. I should assume so because there are. But Dr. Igbabuul, kindly conclude your thoughts on the preventive ways of preventing cholera. You were speaking to us about environmental consciousness, cleanliness, and personal hygiene.
Yes, I said a lot of the preventive measures rest with us as individuals in the community. Like the last caller has said, it has to do with attitude. If you imbibe the habit of always washing your hands before eating, ensuring that the bowl that you which the water is given to you to wash your hands. You know, some people feel that because you just want to wash your hand, they can bring even a dirty bowl and give it to you that has been overused by other people and give it. Meanwhile, you should be conscious that those who washed their hands before you also washed their dirt into the bowl. So simply throwing out that water without washing and then replacing it with another water source is not enough. That bowl itself has to be thoroughly washed with water and soap, and then a new source of water being given to another individual to use. So if we imbibe all this, it will go a long way in order to prevent. Let's not just wait for government. We should be able to keep our environment neat. And simple habits. You go to the toilet, you come out, you should wash your hands. You see food is set before you, you should wash your hand. You have gone out, you met so many people, you have had handshakes with people. When you come back, before you carry something and put into your mouth, you wash your hand. Some people under stress, they are in the habit of putting fingers into their mouths. You know, they bite their fingers, they chew, they put their
or even their nose.
Yes, or even their nose, and then they move from one orifice to another like that. That we need to, if you have such a habit, you have to work over time and make sure that at least during this period, you change that habit. So those are the few things I said I'm going to add. A lot of the success we are going to achieve will depend on the individual.
All right, a lot of the success we are going to achieve will depend on the individual. Okay, Dr. Igbabuul, beyond, one of our callers mentioned earlier, that nobody gets to hear about this until it's outbreak again. Now the outbreak is here with us and we're hearing about it. For instance, iGate Radio has provided this platform for sensitization. What are the kind of activities the ministry is carrying out with regards to getting to the hinterlands, the communities, to sensitize them more on this situation? But let's engage with more people. I'll come back to you to speak on that shortly. Hello, good morning.
Hello, good morning.
Good morning and welcome to Perspectives.
I want to thank you so much for doing a very wonderful program on iGate Radio.
Thank you. May we know your name and where you're calling us from?
My name is Mr. Msuteachi, the young headmaster, Radio Ashiwe correspondent in Kasinala and the headmaster in Ukula government.
Okay, Msuteachi, are you reaching us from Kasinala?
Yes, but now I'm in Ukula government in my farm.
Good to know. How is Ukum this morning? Which part of Ukum to be specific?
In Batian, nearby Sankala.
Okay.
Kado Road.
Okay, Msute, go ahead.
In fact, health is very, very important. There is a saying that a healthy country is a wealthy country. Issue of washing hands and taking proper care on ourselves is very, very important. You may agree with me that if you are taking proper care of your children by feeding them, washing their hands, bathing them, giving them proper treatment, they will be healthy. So I want to advise ourselves that some people think that they are adults, then they cannot wash their hand after going in their turret. This thing is very, very important. And this issue of orientation, giving on radios, televisions, in schools, in churches is very, very important. Because some people are doing that because of illiterate. So I want to thank you so much for giving enlightenment and orientation this morning. Let us do what the people that are in position are telling us. Doctors are telling us. If we do this thing, we may help ourselves than spending money in hospitals. And it's good to prevent than treating. Thank you so much. May God bless you and the radio for doing a very wonderful job.
Thank you very much, Mr. Teachi, and God bless you too for calling in and sharing your thoughts with
Thank
us.
you.
Thank you.
Thank you.
All right. Have a great day. Dr. Igbabuul, you were about to speak to us on what are the sensitization programs or activities being carried out by the government, especially your ministry, to forestall outbreak of cholera in Benue.
Okay. Well, for as far as sensitization on diseases and outbreak is concerned, we have two modes of approach. We have routine sensitization activities. These are activities that are carried out through the channels that are already existing. Just like I mentioned earlier, just like I talked about surveillance structures, we also have like a sister to that structure is also an information dissemination structure for diseases and also its response. So that channel also has social mobilization officers in every local government, and these social mobilization officers have also information officers in communities, through which information is disseminated. Routinely, I think for the last 4 to 5 months, there have been monthly reviews on dissemination through these channels for all the priority diseases, including cholera. Now, the second mode is more of a more proactive approach, and this comes on stream usually when we have when we are on alert, for outbreaks, since the nation is already experiencing outbreaks, and that is also what we've started. If you remembered earlier, I mentioned that within the week we visited traditional healers, also telling them about these cases. And so these are some of the activities. Now these activities are ongoing in all the LGAs, different levels of stakeholders and different levels of the community are being engaged, as in line with our alert mode for a possible cholera outbreak, since we have cases even in states bordering us. So these are some of the activities. So a few months ago, there was a government-sponsored jingle on 6 priority diseases, yes, which ran for I think over 12 weeks. That ended, I think, a month or 2 ago. So we do not necessarily go to sleep until cases begin to come, as part of the state's preparedness plan towards every disease entity, the activities that are marshaled out and which we follow. Now, we may not be able to 100% execute all of them, but as much as possible, we try to carry out these activities, as best as we can. So information dissemination is part of it, and this is what we have been doing, and we are still doing it. It's also in line with what we are doing here. My director has appealed. I will also join my voice with him to also appeal. Public health is everybody's business. So we also solicit for all other media houses to come in, also follow suit with this initiative and see how they can partner with the Ministry of Health, as part of their corporate responsibility to help us, disseminate this information and also knowledge as faster and as wider as possible. You agree with me that via radio, we can reach 1 million people this morning. If we begin to knock on doors, we may be able to reach only 20 per day. So this is a wider medium, and we're always thankful when we have this, and we look forward to more partnerships with you.
Okay.
and others.
Maybe when you were saying that, I could see the content as of director. Perhaps he wants to give Agate Radio the flowers for being taking the lead to bring this free and important sensitization to the public on this subject matter.
Yes.
But director,
Yes.
maybe you want to speak to us more on, because the emphasis of this program is for us to curtail the outbreak. We don't want it to come so that we'll start containing it. We don't want to have cholera. We want it prevented entirely. Beyond this program, what is the sustainability plan of the ministry with regards to ensuring total prevention of cholera in Benue?
Thank you very much for that question. And I want to give kudos to Agate Radio for taking the first step forward. And I expect that other media houses will also do likewise. Like we said, we have the system of public health emergency operations center in place, and we are collaborating using all the resources, the subject matter experts. We collaborate and coordinate the efforts of other line ministries. Each time we are faced with public health disease of public health importance coming out in outbreak proportions like this. Like I've already assured you in the populace that the Ministry of Health, under the leadership of the Honorable Commissioner, the Honorable Dr. Yama Otisi, we are poised and we are ready with our team in all levels, like has been explained by Dr. Ijabo. The system is already in place to pick, and once we pick, we'll go into action in order to make sure that we investigate and we institute all control measures when we are faced with any outbreak in the state. So in response to Peter, one of the callers, he feels that we only spring into action when there's an outbreak. No, the system is going on. The surveillance is a continuous thing. Everybody's on ground, and that is why once we have some of these cases, they are reported. When the cases reach an outbreak proportion, then that is when a lot of information is passed out in the media. Like I believe Agate got into action as a result of the other states being affected, particularly Nasarawa and neighbors being affected. Now, I want to remind us that some of these diseases, they run a seasonal course. Like cholera, this is the season for it. And so when it is close to the season, more effort has been made in order to raise consciousness and create more awareness in the populace. And that is probably the reason why they are getting to hear more about it. And I think once we hear, it's not just making sure that the information is on air, but prompting people to take action about their own personal health, about their own hygiene, and not behaving like when you hear adverts of cigarette smoking and they say cigarette is dangerous to your health, and you know the average smoker doesn't even read what's written on it, even though the pack comes with that warning. But they just go ahead. But so what I'm saying is that let us take action when we listen to this awareness creation, sensitization of our people. That's what I'm saying.
All right. When you mentioned that particular using the scenario of cigarette, I remember a picture of a certain smoker. He was told that it is written on his smokers are liable to die young, and he said at his age, if he dies, he's no longer dying young. So, all right, the line is still open for you to call in 0814-335-9292, 0814-335-9292. You can send us a message on 0912-2699-9404. Dr. Obam, I am with you now. The health-seeking behavior of our people, especially now that we have a cholera, what are the kind of things that our people need to imbibe more to prevent its spread?
It's okay. Thank you very much. Like I said earlier in the management, I needed to add that in managing these patients with cholera, there's a pattern of approach. That is, you manage the patient, you manage the family, as well as the community. Most times, people in Nigeria actually have poor attitude to seeking medical health care, because individuals who come down with these symptoms, profuse diarrhea, they might be at home doing what they feel, might be able to curtail this infection, not knowing that it is always better to go to the next hospital or facility that is close to your house.
I'll beg to interrupt you. Let's engage. Several people have been waiting on the line. I'll just beg you to hold on. Hello, good morning.
Good morning, my brother.
Welcome to Perspectives.
Thank you, sir. I'm on that Gabriel from the next one.
Good to have you on the program, on that Gabriel.
Thank you, sir. And my regards to the girls in the house.
Yes, go ahead on that.
They are talking much about the deadly disease. I thank Agate Radio for the awareness.
Thank you.
And my own take is this. People say that it's very good to prevent rather than to cure. Prevention is better than cure. So the diseases that we have aware of, we want this awareness to be taken to the rural areas where people don't hear things at all. I want the government to help us and then take this awareness to all the rural areas so that the people can be aware. Though we have not experienced it in Benue State, but yet we want to be free from it. So freedom from it is to be aware. What I need the government to do for us is awareness. Thank you, sir.
All right, thank you very much, Ondachi Gabriel. Awareness, and that awareness is part of what this program is intended to bring, and government is called upon to do more. We appreciate you for calling in, Ondachi Gabriel. Please continue with your thoughts, Dr. Obam.
All right. So with this poor health seeking...
But again, I'll beg you.
It's okay.
I'll beg you.
It's good.
I'll come back. Hello, good morning.
Hello, how are you, sir?
I am fine. Kindly move away from your radio or turn down its volume.
Yes, I am calling. I'm calling from behind the commissioner's village.
Okay.
Yes, in Makurdi.
I would like.
Our problem.
I would like to.
Our problem
hello.
is.
Hello.
A way.
Hello, sir.
Hello.
I would like to appeal that you move away from your radio set or turn down its volume. So let's know your name. You say you are calling from behind commissioner.
My name is Native. My name is Native.
Deki who?
Native Onwuka.
Okay, go ahead, Onwuka.
I'm behind the commissioner's village.
All right, here in Makurdi. Go ahead.
Here in Makurdi. Our problem is that we have grammatically spoken about the cholera. What we are going to let the people on the radio there tell us the immediate effect, how we can solve problems. Because there are people that logistic problem can send them to grave. If have a way, please take this before we go out. I thank Agate Radio. They are always bringing something that is very crucial within us here in Makurdi. Please, what can we do immediately? Is it to take a salt, to take this, something a poor man can easily do? Because every man in Nigeria is a local government of himself. You provide water, you provide light, you provide all you need. So what do we do immediately? What do we need to do? Please, let the doctors give us. Because it's not everybody that can be accessible to the nearest clinic or the nearest primary health center. If you are vomiting, a child is vomiting, oh, please bring this immediately. Or we shout, neighbors will come. That's number one. We shout, my child is vomiting, oh, and cholera is not a seasonal issue. It can come at any time. Somebody can purge. Somebody can do anything at any time. Disease has no time to come. So let us be pleased to hear from them. Yeah, the doctors. They've spoken fine.
Okay.
Talk is very cheap. Please,
Onwuka, thank you.
let us know immediately what we can easily do in the house before we go out.
All right.
Logistics in Nigeria is very difficult.
Thank you
Before
so much.
you come out to the main road, somebody will give up.
All right, Onwuka, thank you. I didn't get the other name quite accurately. Maybe I'll...
Native, N-A-T-I-V-E, Onwuka.
Okay, all right. Thank you so much. We appreciate you for calling. Thank you. All right. Dr. Obam,
just like
maybe you wrap it together with Onwuka's concern because it's part of the health-seeking behavior of our people which you were speaking about.
So just like I was saying, so if an individual comes to the facility, it's actually the responsibility now of the physician to manage this patient, manage this family and the community. How do you manage the family? Of course, this patient has come with these symptoms of profuse diarrhea, maybe no dehydration or comes with severe dehydration. After resuscitation and treatment and you are about to discharge this patient, it's expected that you also go to the house and look at the environment in which this person is coming from. What is the source of their water? Who are the persons that are still living in the same household with this patient? Are they liable to also come down with such illnesses? So the duty is on the physician to even help educate them that are home. So with this patient too, you can also locate the community in which this person is coming from. Either the leaders of the community can be approached so that at least at that point, preventive measures, health education can also be taught to this person so that at least they should be encouraged to always come to the hospital when they have any health challenges. And just like Onwuka said, well, the first thing, like the director said, is to give ORS, oral rehydration salt or therapy, is readily available in any of the even patent medicine stores have them. And the directive is always there. Some will say drink liberally, but for a patient who is already in mild or moderate dehydration, there is no need for such a patient to be kept at home. So it's always advisable that for especially children who are having diarrhea, once a child is noticed to have diarrhea, the immediate thing you're supposed to do is to give ORS. But then, how do you evaluate this person? How do you categorize this person? You don't have that knowledge to do that at home. So it's always advisable to go to the next facility, and we are aware that even primary healthcare centers are also closer to the people. General hospitals are there, even teaching or tertiary institution in the town too is also there. No matter what it is, it's always better to go to the hospital when a child is having diarrhea, so that evaluation and prompt treatment will be done. Thank you.
All right. So, Dr. Igbabuul, also let's beyond the ORS and other palliatives or immediate measures, we'll talk about what the people on their own part need to do as well in their home states. But let's engage with a few more persons. Hello, good morning.
Hello.
Welcome to Perspective.
I greet Radio.
We greet you
too.
too.
The doctors in the house.
Thank you.
I appreciate us as a nation because while I've been listening to this discussion.
May we know your name, please?
Jambok, calling from Old Assembly Quarters Triangle. I live in Makurdi.
Okay.
The thoughts that came to my mind, accumulated priorities of every society is what they get. Accumulated priorities. What are our priorities in this society? You can check the budget. Check the budget of this nation and our state and local government, the things that our leaders and even we as individuals are concerned about most of the time are the priorities that are going to keep our health in the proper state. Most times,
What concerns us is aggrandizement. This man comparing ourselves one with another. You build a house, you cannot provide a toilet, but you want plenty of money so that the next time they see you, you are wearing a very big agbada, looking very nice outside, but back in your house you have no toilet. You are going to open defecation at night. As government itself, when you look at it, what do you see? Big cars that are going all over. Even if you go into the health sector, calculate the number of cars in the Ministry of Health and the various segments of the health sector of our society. You discover that the thing that is stopping most of the money is vehicles, fuel, tires, and so on. The practical on the ground day to day will hardly to be found. Thank you.
Thank you, Adabaka. We appreciate you. We appreciate you for calling me. Okay, let's take a few messages. When we come back, you respond to what you are about to speak to us on. This one says, good morning to Agate Radio. My name is Uncle P from High Level Makurdi. My question is that, is it advisable to use ordinary water and salt to mix together to treat cholera locally? Okay, we'll come back to your question. This one says, good morning, presenter. My name is Abite Teso from Logo 1. What are the bacteria that causes cholera? The government should also create awareness for rural areas for the prevention of cholera. All right, thank you, Abite. This one says, it is our concern to give adequate treatment to those who are affected from the foregoing disease, either by medical care or in one way or the other, but maintain a good personal hygiene and sanitation as precautionary measures. Good morning, panelists. Isaac Utsua from Iyengom. Okay, Isaac, thank you very much for your message. We appreciate you. Dr. Igbabuul, our time is fast ticking away, and I request you to speak to us about the health-seeking behavior of the people, the immediate things people need to do in their homes, palliative things, beyond the ORS and some of these immediate measures that could be taken, and then we'll respond to these concerns people raised here.
Thank you. I hope they have a biro and paper to jot down, because I'll simply just, they call an Echi, ask for what to do.
Yes.
And I want to say it in that priority order. First of all, like he said, the caller said prevention is better than cure. You need to look closely on your personal hygiene. Make sure you wash your hands more often, and ensure that before you eat anything, you wash your hands before and after. When you use the toilet, make sure you wash your hands. You make sure you participate in taking care of your, keeping your environment hygienic, and make sure you clear your environment. Join up with your neighbors to do that. Discard that refuse properly. If possible, incinerate them, and treat water sources and before you drink. And in addition, if you notice that the frequency of stooling has increased, make sure you go for ORS. The ORS sachet that can be bought from the chemist is maybe now more cheaper than going to buy salt and sugar all together, because sugar has become very expensive. So ORS, if you buy one in 1 liter of water, and make sure you give that child or yourself, take as much as up to 6 liters per day. That will also help you a lot. Now, yes, caller also said, can we use salt and sugar? Yes, we teach that 1 level teaspoonful of salt and 10 of sugar in a bottle. Yes. Bottle filled with water which has been washed.
In particular, said water
you mix it up.
Mixed with salt. You didn't specify sugar.
Like I'm mentioning the amount of salt.
Okay.
Just a teaspoon of it leveled teaspoonful of salt, 1, and then sugar, 10 level teaspoons. But if you are using cube sugar, just 5, and then you mix up with drinking water, measured with a beer bottle. That will suffice, and you take as much as possible. But if you keep overnight, please discard it. Don't take another one, the same one the next day. Prepare a fresh one and take. Whereas I'm saying, because things are so expensive now, it may be cheaper for you to just go for that WHO standard ORS sachet, which you can buy and then mix it up with 1 liter of water and take as much as possible. And immediately, don't delay. go and report to the nearest health facility. There are 276 primary health care scattered all over the world in Benue State, and there are also 22 government general hospitals that are also available. In Makurdi here, we have the Air Force Base, which is also a government secondary health care facility. And then we have 3 teaching tertiary health facilities, including two teaching hospitals in Benue State, one in Makurdi, one in Otukpo. You can go to any of these facilities in addition to the private ones that are all over the place. There are good private primary as well as secondary health facilities in Benue. Feel free to walk to any of them and you will get help. These are measures that you need to do.
Okay, Dr. Igbabuul, Teso Abite from Logo 1 is asking us what are the bacteria that causes cholera. Maybe he joined us midway, just refreshing on that in 1 minute, very briefly. Then we'll try to draw our concluding thoughts.
Okay, like I mentioned, cholera is a bacterial infection. It's caused by bacteria known as Vibrio cholerae. That's the name of the bacteria that causes that.
All right, so Teso, I want to believe you have gotten your clarification. We are gradually drawing to a concluding part of the program because our time is no longer there, but we'll engage with one more call and then we'll try to wrap it up. But before we take one more call, Dr. Obam, this will be part of our general evaluation of the healthcare system. How functional are our primary healthcare centers and even the secondary and tertiary centers to curtail cases of cholera if eventually we have an outbreak of it in the state? How prepared? Where can people go to? What do they need to do?
Okay, thank you. The health sector, the health facilities in Benue State particularly, I'm aware that they are well prepared, ranging from the list the director has mentioned, and starting from the primary health care, at least at that level, they should be able to manage either no dehydration or mild dehydration to moderate dehydration with an ORS therapy. So at that level, they should be able to have that. Even if the patient comes with severe dehydration, I think at that level too, they should be able to recognize this condition at that level and refer appropriately. Then at the level of the secondary level of healthcare too, they are readily prepared to handle most of these infections that will come over, most of these cases that will come to the facility, at least by providing the immediate management or treatment that these individuals are coming with. Of course, for a patient to go to a tertiary institution, and maybe if the person has just decided to go to tertiary institution, it's not at the level of primary and secondary school, secondary level of health system, they should be able to curtail or manage appropriately this infection by Vibrio cholerae. So at the level of the health care facilities in Benue State, I think the readiness is there, even though there is still more appeal or more plea for government to support them, support the primary health care centers, the secondary level of health, as well as the tertiary level of health, to support them with consumables and medications, as well as manpower too as well. Of course, the welfare of the people working there too is also important, so that they will be able to be alert psychologically in handling these patients that also come in. So in as much as they are ready, there's still need for government to still support these facilities.
All right, Dr. Igbabuul, in all of this, the Ministry of Health and Human Services is at the center of it. Part of what earlier on all three of you discussants alluded to as causative factors: sanitation, personal hygiene, and even access to safe water. Is there any collaboration between the ministry and the Ministry of Water Resources and Environment, for instance, to ensure that there is provision of potable water for the people to do away with cases of cholera outbreak in Benue?
Thank you very much. Like I said, we have a Public Health Emergency Operations Center, and that is the command center for handling disease outbreaks in the state. And once there is an outbreak, the EOC is activated specifically for that outbreak, and it's involved subject experts from all the line ministries, including the ones you have mentioned, and they come together and will make sure that everybody plays his own part in order to mitigate the problem. Particularly Ministry of Water and Environment, there are programs, the WASH program, which is being operationalized between the staff of the Ministry of Health as well as the Ministry of Water and Environment, and that is ongoing at the moment. And we continue to collaborate with all the other line ministries, including Ministry of Agriculture, and we know that this collaboration is bearing fruits because in all the engagements, everybody is made to play his own part. Like in this kind of situation here, we can't do everything. We look at the health aspect of it, making sure that surveillance is robust and enough to pick cases, and making sure that we put control measures in order to make sure lives are saved. There is case management, and then the risk communication aspect of it. These are all pillars that are already there in place in the EOC to manage such a situation. So yes, the answer is yes. We are collaborating to make sure that every ministry, department, and agency is playing its own part.
All right, our time is up, and this will be our concluding thoughts. Dr. Igbabuul, can you give us your concluding thoughts on what people at the community level basically need to do at this time to prevent cholera?
Okay.
In 1 minute, please.
A lot has been said today. For me, I think the key takeaway will be constant and continuous hand washing. We need to prioritize that as a practice. The director has mentioned that again and again. Constant and continuous hand washing. We need to be sure of the source of our water. If we do not have potable water, we ensure that we boil or treat with materials such as water guard and the likes. And then we also need to spread, as you listen and get this information, spread it. Let your neighbors also know what you know. It could save a life. Cholera is not treated at home. We ensure that as you begin ORS management, please get yourself to the nearest facility as fast as possible. It is treatable and it is curable only if it is detected early.
All right, it is treatable, curable if it is detected early. Dr. Obam, from a clinical and a medical point of view, how early should symptoms of cholera be presented in the hospital, in one word?
Okay, the incubation period for cholera is from hours to about 6 days. Some books state 6 hours or 12 hours. So within those period, an individual is expected to come down with symptoms and is expected to be in the hospital as soon as possible to prevent complications and prompt management.
Okay, there are complications to it.
Of course, dehydration will lead to a lot of complications like acute renal injury or failure. Person might be in shock. Those are the complications we have listed earlier.
Okay.
Yes, sir.
Dr. Igbabuul, your parting words to Benue people on what they need to do at this time that cholera is ravaging other parts of the country, and what we can do to foster its outbreak in Benue.
We all have to,
where they can go to in event of any suspected case.
This is the season for cholera, and we must all be conscious of that fact. So let's change that behavior. If you've not been washing your hands frequently and properly, this is the time for you to imbibe the culture of hand washing. Ensure and be aware that your water intake and the source of food should be one that is free from contamination. And if you notice that your 2-year-old and above from your household or any member of your household starts to experience frequent stooling, please ensure you get the nearest chemist, get ORS, and rush that child or yourself to the hospital. The earlier you get there, the better and the success will be the treatment.
Okay, and this is where we must conclude on today's edition of Perspectives, which we focused on sensitization for the prevention of cholera in Benue State as part of Agate Radio's sensitization on the issue given its outbreak in the country. We don't want it to be experienced in Benue, and that is why we brought you this program to tell you what to do at this time. We must appreciate very sincerely our discussants on the program, the Director Public Health in the Benue State Ministry of Health and Human Services, Dr. Shember Igbabuul. Thank you very much for coming on Perspectives, Director.
Thank you for having me.
The Assistant State Epidemiologist in the Benue State Ministry of Health and Human Services, Dr. Henry Ijabo, also joined us and he shared his thoughts with us. Dr. Ijabo, we are grateful to you.
It's always a pleasure to be here.
The resident doctor in the Department of Family Medicine at the Federal Medical Center, Makurdi, Dr. Emmanuel Obam. We are grateful to you for sharing your valuable time with us on the program.
Thank you very much. I'm grateful.
That's our program for today. I hope you had every tip of the information we give you and you take it serious to stay safe. Join us again on Wednesday for another edition of Perspectives, which will focus on another issue. I am Nathaniel Nongu. Stay safe and have yourself a great week. I'll see you on Wednesday. Goodbye.